When disaster strikes, don't let it keep you down. At TCCU, we are here to help you recover and rebuild. Whether you need to repair your home, replace essential appliances, restore your business, or secure your property, our disaster loan special has got you covered. Act now, recover, and rebuild. Thrive with TCCU. Visit any of our branches today or schedule your appointment online at www.tccusvg.com. Together, we can weather any storm. SVG TCCU Limited. Terms and conditions apply. Ready to hit the road in your dream car? With our exclusive vehicle loan special, you can. At SVG TCCU Limited, we offer unbeatable rates, flexible terms, and fast approvals. Whether it's a sleek or sporty car or a rugged SUV, we've got you covered. Don't wait, accelerate. Fuel your future with SVG TCCU's vehicle loan special. Visit any of our branches today or schedule your appointment online at www.tccusvg.com. Drive your dreams with SVG TCCU Limited. Terms and conditions apply. When disaster strikes, don't let it keep you down. At TCCU, we are here to help you recover and rebuild. Whether you need to repair your home, replace essential appliances, restore your business, or secure your property, our disaster loan special has got you covered. Act now, recover, and rebuild. Thrive with TCCU. Visit any of our branches today or schedule your appointment online at www.tccusvg.com. Together, we can weather any storm. SVG TCCU Limited. Terms and conditions apply. Ready to hit the road in your dream car? With our exclusive vehicle loan special, you can. At SVG TCCU Limited, we offer unbeatable rates, flexible terms, and fast approvals. Whether it's a sleek or sporty car or a rugged SUV, we've got you covered. Don't wait, whether you need to repair your home, replace essential appliances, restore your business, or secure your property, our disaster loan special has got you covered. Act now, recover, and rebuild. Thrive with TCCU. Visit any of our branches today or schedule your appointment online at www.tccusvg.com. Together, we can weather any storm. SVG TCCU Limited. Terms and conditions apply. Ready to hit the road in your dream car? With our exclusive vehicle loan special, you can. At SVG TCCU Limited, we offer unbeatable rates, flexible terms, and fast approvals. Whether it's a sleek or sporty car or a rugged SUV, we've got you covered. Don't wait, accelerate. Fuel your future with SVG TCCU's vehicle loan special. Visit any of our branches today or schedule your appointment online at www.tccusvg.com. Drive your dreams with SVG TCCU Limited. Terms and conditions apply. When disaster strikes, don't let it keep you down. At TCCU, we are here to help you recover and rebuild. Whether you need to repair your home, replace essential appliances, restore your business, or secure your property, our disaster loan special has got you covered. Act now, recover, and rebuild. Thrive with TCCU. Visit any of our branches today or schedule your appointment online at www.tccusvg.com. Together, we can weather any storm. SVG TCCU Limited. Terms and conditions apply. Ready to hit the road in your dream car? With our exclusive vehicle loan special, you can. At SVG TCCU Limited, we offer unbeatable rates, flexible terms, and fast approvals. Whether it's a sleek or sporty car or a rugged SUV, we've got you covered. Don't wait, accelerate. Fuel your future with SVG TCCU's vehicle loan special. Visit any of our branches today or schedule your appointment online at www.tccusvg.com. Drive your dreams with SVG TCCU Limited. Terms and conditions apply. When disaster strikes, don't let it keep you down. At TCCU, we are here to help you recover and rebuild. Whether you need to repair your home, replace essential appliances, restore your business, or secure your property, Our disaster loan special has got you covered. Act now, recover, and rebuild. Thrive with TCCU. Visit any of our branches today or schedule your appointment online at www.tccusvg.com. Together, we can weather any storm. SVG TCCU Limited. Terms and conditions apply. Ready to hit the road in your dream car? With our exclusive vehicle loan special, you can. At SVG TCCU Limited, we offer unbeatable rates, flexible terms, and fast approvals. Whether it's a sleek or sporty car or a rugged SUV, we've got you covered. Don't wait, accelerate. Fuel your future with SVG TCCU's vehicle loan special. Visit any of our branches today or schedule your appointment online at www.tccusvg.com. Drive your dreams with SVG TCCU Limited. Terms and conditions apply. When disaster strikes, don't let it keep you down. At TCCU, we are here to help you recover and rebuild. Whether you need to repair your home, replace essential appliances, restore your business, or secure your property, our disaster loan special has got you covered. Act now, recover, and rebuild. Thrive with TCCU. Visit any of our branches today or schedule your appointment online at www.tccusvg.com. Together, we can weather any storm. SVG TCCU Limited. Terms and conditions apply. Ready to hit the road in your dream car? With our exclusive vehicle loan special, you can. At SVG TCCU Limited, we offer unbeatable rates, flexible terms, and fast approvals. Whether it's a sleek or sporty car or a rugged SUV, we've got you covered. Don't wait, accelerate. Fuel your future with SVG TCCU's vehicle loan special. Visit any of our branches today or schedule your appointment online at www.tccusvg.com. Drive your dreams with SVG TCCU Limited. Terms and conditions apply. When disaster strikes, don't let it keep you down. At TCCU, we are here to help you recover and rebuild. Whether you need to repair your home, replace essential appliances, restore your business, or secure your property, our disaster loan special has got you covered. Act now, recover, and rebuild. Thrive with TCCU. Visit any of our branches today or schedule your appointment online at www.tccusvg.com. Together, we can weather any storm. SVG TCCU Limited. Terms and conditions apply. Ready to hit the road in your dream car? With our exclusive vehicle loan special, you can. At SVG TCCU Limited, we offer unbeatable rates, flexible terms, and fast approvals. Whether it's a sleek or sporty car or a rugged SUV, we've got you covered. Don't wait, accelerate. Fuel your future with SVG TCCU's vehicle loan special. Visit any of our branches today or schedule your appointment online at www.tccusvg.com. Drive your dreams with SVG TCCU Limited. Terms and conditions apply. When disaster strikes, don't let it keep you down. At TCCU, we are here to help you recover and rebuild. Whether you need to repair your home, replace essential appliances, restore your business, or secure your property, our disaster loan special has got you covered. Act now, recover, and rebuild. Thrive with TCCU. Visit any of our branches today or schedule your appointment online at www.tccusvg.com. Together, we can weather any storm. SVG TCCU Limited. Terms and conditions apply. Ready to hit the road in your dream car? With our exclusive vehicle loan special, you can. At SVG TCCU Limited, we offer unbeatable rates, flexible terms, and fast approvals. Whether it's a sleek or sporty car or a rugged SUV, we've got you covered. Don't wait, accelerate. Fuel your future with SVG TCCU's vehicle loan special. Visit any of our branches today or schedule your appointment online at www.tccusvg.com. Drive your dreams with SVG TCCU Limited. Terms and conditions apply. When When disaster strikes, don't let it keep you down. At TCCU, we are here to help you recover and rebuild. Whether you need to repair your home, replace essential appliances, restore your business, or secure your property, our disaster loan special has got you covered. Act now, recover, and rebuild. Thrive with TCCU. Visit any of our branches today or schedule your appointment online at www.tccusvg.com. Together, we can weather any storm. SVG TCCU Limited. Terms and conditions apply. Ready to hit the road in your dream car? With our exclusive vehicle loan special, you can. At SVG TCCU Limited, we offer unbeatable rates, flexible terms, and fast approvals. Whether it's a sleek or sporty car or a rugged SUV, we've got you covered. Don't wait, accelerate. Fuel your future with SVG TCCU's vehicle loan special. Visit any of our branches today or schedule your appointment online at www.tccusvg.com. Drive your dreams with SVG TCCU Limited. Terms and conditions apply. When disaster strikes, don't let it keep you down. At TCCU, we are here to help you recover and rebuild. Whether you need to repair your home, replace essential appliances, restore your business, or secure your property, our disaster loan special has got you covered. Act now, recover, and rebuild. Thrive with TCCU. Visit any of our branches today or schedule your appointment online at www.tccusvg.com. Together, we can weather any storm. SVG TCCU Limited. Terms and conditions apply. Ready to hit the road in your dream car? With our exclusive vehicle loan special, you can. At SVG TCCU Limited, we offer unbeatable rates, flexible terms, and fast approvals. Whether it's a sleek or sporty car or a rugged SUV, we've got you covered. Don't wait, accelerate. Fuel your future with SVG TCCU's vehicle loan special. Visit any of our branches today or schedule your appointment online at www.tccusvg.com. Drive your dreams with SVG TCCU Limited. Terms and conditions apply.
Some weed and a bottle of booze. All I wanna do is smoke, drink, and love my girl to some reggae.
Hear that? Them think it's a joke. Sister, talk to them now. It's real. Do you have any doubt? This one we're talking about. Nothing.
Under the pressure, yeah, under the pressure. If your boy job is take away now, we cheat in a second cause we all under pressure, my friend. Sometimes when you feel it, you cry down. I hurt your heart, you know, but do not make it stress you cause it happy be better, not be living at the ghetto, to be under the pressure, my friend.
From we born in the struggle, isolated in a bubble. One half in the rich, yet another for the poor. God bless and please help us, we can't take no more. We're feeling the pressure, we are down to the core. Oh, money for the and when them send it offshore. And every nation come here get rich and we stay poor. Them show you $20, we go through the back door. Tell them, so we can't take no more.
Under the pressure, yeah, under the pressure. If your boy job is take away now, we cheat in a second cause we all under pressure, my friend. Sometimes when you feel it, you cry down. I hurt your heart, you know, but do not make it stress you cause it happy be better, not be living at the ghetto. pressure erupt, me never give up. No, me never give in. And me, I'm setting up a prayer for the better living. I can't ball, so I better be sing. And so under the pressure, yeah, under the pressure. If your boy trouble take away now, we cheat in a second, cause we all under pressure, my friend. Sometimes when you feel it, you cry down. I hurt your heart, but do not make it stress, cause it happy be better, not be living at the ghetto, to be under the pressure, my friend. It's serious, a lot of times I find it serious. Life is a little mysterious. Some we put and we can't even steer it up, oh no. I can't wait for morning come. Oh gosh, the night too long. Oh gosh, the fight too long. I can't wait to see the sun. Under the pressure, yeah, under the pressure. If your watch up and take away now.
So good afternoon again. Welcome to the annual Health Symposium put on by the St. Vincent and the Grenadines Teachers Cooperative Credit Union. For the past few years, we've been doing a symposium. We had touched on cancer, non-communicable diseases, but this afternoon we just going to do a general discussion, conversation, and that will ask persons to just fill up the front seats. And we want to welcome those persons online. We are live on our YouTube page, and we're also live on the Teachers Cooperative Credit Union Facebook page. My name is Johnny P. Stricker. I'm the host or moderator for this afternoon. We have 4 esteemed doctors. I feel like I'm watching TV, like, House and the General Hospital. Put your hands together for the panelists this afternoon as we get started. Usually with symposiums and discussions, we will give persons, the panelists, some time to speak or discuss, but this afternoon we'll do it a different way. We have some in-house questions, and we'll encourage after that some questions from the audience, and also for persons who are viewing or following online on YouTube and Facebook, you can just drop those questions or comments in the comment section this afternoon. So once again, I want to thank you very much for being a part of this symposium. You know, they say your health is your wealth, and of course they also say your health is everyone's responsibility. So the Teachers Cooperative Credit Union, we are doing our part just to make sure that everything is A-OK with everyone. Good. With that said, the panelists. This afternoon, 2 ladies, 2 gentlemen. We'll start with the ladies. I saw a bio from Dr. Giselle Miller. It's about 17 pages, but so I'll encapsulate. Dr. Giselle Miller is a health psychologist and holds a PhD in health psychology from the University of Birmingham, UK. She also holds a MSc degree in applied psychology, specializes in health, a Bachelor of Science with honors, psychology from the University of the West Indies Mona campus in Jamaica, and is certified as a qualified assistant teacher with special training in secondary level education. Dr. Miller serves also as a wellness consultant and is the founder of the Value Experience. Value, being the Latin word for wellness, promotes the holistic wellness of the individual, allowing the person to achieve their fullest potential through this avenue. NLP certified resilience life coach with excellence assured, that's in the UK. Dr. Miller is the founder and president of the Scotch Cancer Support Foundation here in St. Vincent and the Grenadines, medical psychology professor at Richmond Gabriel University College of Medicine, EAP and psychological wellness consultant, post-traumatic recovery and growth coach, the author of the book I Am, a book of affirmations. She's also the co-author in academic journal on exploring the pressures of medical education from a mental health and wellness perspective, and that was in 2017. Amazon listed bestseller for 2021, a publication called Unstuck, Creating Your Bounce Back Effect. She's a weekly columnist in the Searchlight newspaper here in St. Vincent and the Grenadines, host of the radio program on NBC Radio, 705, Heart to Heart with Dr. Miller, and of course the number one in the morning on Thursday, half an hour in the morning, with of course Johnny P. Who else? International, regional, and local speaker on psychological related topics, entrepreneur and co-owner of Luxury Picnics here in St. Vincent and the Grenadines, and the producer and host of the One Step with Dr. Giselle Miller podcast and the talk show. Ladies and gentlemen, put your hands together for Dr. Giselle Miller. Dr. Camille A. Nichols. After graduating from St. George's University School of Medicine, Dr. Nichols returned to St. Vincent and the Grenadines and spent 2 years completing her internship program offered by the then Kingstown General Hospital. At the end of her internship, she worked in the Department of Obstetrics and Gynecology, and Dr. Nichols did an 18-month stint as the District Medical Officer in the districts of North Leeward and Beckway. After passing part 1 of her postgraduate exam in Jamaica, Dr. Nichols went to the United Kingdom to pursue postgraduate studies in obstetrics and gynecology, with 18 months training in the United Kingdom. Under her belt, she was accepted as a member of the Royal College of Obstetricians and Gynecologists in 1998. Armed with her membership, Dr. Nichols decided to gain some postgraduate experience before returning home. She was offered a 2-year training program in Scotland and rotated through 3 hospitals, including the Simpson Memorial Hospital in Edinburgh, which had the largest delivery rate in the United Kingdom, 7,000 deliveries per year. Dr. Nichols returned to St. Vincent and the Grenadines and was appointed consultant obstetrician gynecologist in 2001. She is now head of the Department of Obstetrics and Gynecology at the Milton Cater Memorial Hospital. She also operates her own practice at the Victoria Medical Center. In 2006, Dr. Nichols was inducted as a Fellow of the American College of Obstetricians and Gynecologists, FACOG, and in 2011, she was admitted as a Fellow of the Royal College of Obstetricians and Gynecologists. Dr. Nichols is an advocate on women's health issues and readily accepts requests to meet with institutions, women organizations, church groups, and school children, empowering them with knowledge and information. Put your hands together, ladies and gentlemen, for panelist number 2, Dr. Camille Nichols. Notice the doctors Murray and Dishong were very modest with their bios. Dr. Rohan Dishong is a consultant urologist at the Milton Cater Memorial Hospital and operates Surgical Associates. Put your hands together for Dr. Rohan Dishong. And Dr. Wayne Murray is a general practitioner who operates Sanctuary Medical Clinic located in Morris Village, where he now only provides medical care that not only provide medical care for his patients, but also his community. Put your hands together, ladies and gentlemen, for our 4th and final panelist this afternoon, Dr. Wayne Murray. At this time, we go straight into the question and answer part of the discussion or symposium this afternoon. As mentioned, a little later on, we'll give you the opportunity to just pose the questions, and we want to invite as well, again, those persons online. Question number 1, and this would be answered by each of our panelists. In your opinion, what is the most significant barrier to achieving holistic wellness among your patients, and how healthcare systems address these challenges effectively? Sounds like a university question, but I'll repeat. In your opinion, what is the most significant barrier to achieving holistic wellness among your patients, and how can healthcare systems address these challenges effectively? I'll take a seat at this time, and each doctor have a mic in front, and we'll just go through with the discussion. Anyone can go first.
First, I'd like to say it's a pleasure being here once again to share some of my learned expertise with the audience here and who are online. I hope that I am able to transmit information which you can actually put to good use. As I've always said initially, I'm a very simple man. I try not to make things too complicated, and I try to give information relative to how individuals will be able to understand. Like my bio is very simple. My information always tends to be to the earth, to persons who I meet, whom I can communicate with. Clearly, we are in a century where healthcare is not just a matter of a physician seeing a patient and say, take a pill. Now we have individuals who are open to more information. Education is widespread. Persons can have information which are in the heads of a physician. And therefore, the practice of medicine is no longer a case where what the physician says is what you do. Persons have all right to review and to research even before appearing to the physician. So it's always important to know that the view of health is not just one gives and one swallows. It has a lot to do with how does your patient comprehend, understand, and this can be as simple as, does your patient speak your language? Because that can be complicated. So communication is important. Holistic health is about an individual understanding where their spectrum is relative to the environment, the genetics, and what they do in their social life. These days you can change the genetics, but that's not that much. And where you live, yes, you can move, but we live here. And the job that you do and the place you live, one has to learn how to live a good, healthy life with reference to your situation. And as a physician, we have to ensure that patients try to realize what is realistic. In many cases, people think that having good health is following a chart that was prepared in Scotland or the UK or Australia. And that's where people get it wrong. One has to understand the environment, where you live, what food you have that's available, what you can afford, and what you can continue doing over and over. And therefore, as a physician, persons who present with health issues are not just simply of a case of an infectious disease, possibly, or something which you can write a prescription and head back home. We do a lot of counseling in relative to being very realistic to what you read on Google does not necessarily relate to you. And at your own circumstance, because where you live, if you live in certain areas, you are more susceptible to certain things. If you live where I am, you're susceptible to shot. If you live along the beach, you're susceptible that you can drown. In a sense, physicians have to understand the circumstances of people and their own circumstances. Is your farm up on a hill, or are you a fisherman? Because what I may think is excellent for an individual who has a nice, cushy office job for his or her back pain will not work for an individual who has to carry all the machine up the hill back and forth. I have to understand this individual. So, in essence, physicians looking at a holistic approach is not just, as many people will, it's not just a definition. It's the concept of understanding your patient, being able to communicate with your patient, because the first basis is to be clear on why your patient is here, because without knowing that, you're just off the shot. You can only hit the target that you're most likely actually looking at. So, in a sense, healthcare is not just what's the diagnosis, it's the individual, knowing the circumstance, the environment, the genetics, the experiences before, what they have been told before, and what information which they have bring forth. And all of that, believe me, you need to put this in your head within this, as a GP, you got to put this in your head in a matter of 5 minutes, because people usually do not have lots of patience for lots of questions and lots of plodding. And therefore, all of this we need to put together very, very quickly in order so that we can actually entertain this individual, they can follow us, and they can take away what we give them. You can't give them too much, or else they just forget it. And therefore, holistic view of medicine is not just a matter of, let's say, getting an MD or leaving medical school. It's understanding all this relative to where you are and the patient who presents in front of you.
A pleasant good afternoon to everyone, and thank you for the invitation to be here. So as it relates to holistic wellness and understanding how then can we overcome some of the barriers, one of the barriers that I would have seen over the years as it relates to patient care, in some situations we realize that there isn't much of a collaboration between healthcare practitioners. And when we think of the holistic approach, we are looking now at the individual, the patient, as an overall entity. And if we have comorbidities, meaning that we are now looking at different varying illnesses, often we have situations where persons are only treating what is relatable to them and not looking at the other things that may be going on within that patient that, based on your treatment plan, how is this going to be affecting what the other doctors may have prescribed or what they're doing. One of the other things we often note is that when we think in terms of the patient, the support structure, the support system that is there, not just in terms of relationships and family and friends to be there, but the support financially. So when we think from a holistic standpoint and we want to look for the overall treatment process for this patient, sometimes patients will say that I can only prioritize what I can afford right now. So there are certain things I have to shelf. And you may find as well that whilst the doctors might prescribe a particular medication, a patient might say, look, this is more generic. Let me go for the generic brand and not this particular brand that, might be more effective. We have to also think in terms of even, as Dr. Murray spoke about communication, the understanding that the patient has in terms of what is going on within them and how they can also be a part of their treatment process. Integrating, being multidisciplinary, so that when you see a patient, we have to think in terms of psychology, nutrition. We have to think in terms of basically allowing that person to be able to come along on the process. It's not just the doctor saying. And I think we have had a significant shift over the years in medicine where it is not so much a case where doctors are telling patients what to do exactly, but most of patients are now coming with their own understanding, their research, their questions, and they're also being a part of the process. So they are now able to explain why I do not wish to do this as opposed to doing this other option and come into a clear understanding. One barrier with patient care often may be even the educational level, getting persons to understand fully all of the different things, the intricacies of this particular illness. And then we have the naturopathic therapies where persons are now trying to decide, should I go with this pharmacological method versus the natural methods? Then we have, and I know Dr. Dishong will blink an eye at me, faith. When we talk about how do you cope, and some persons rely on their spirituality as opposed to wanting to take, other invasive measures of surgery and other things because I'm going to trust in God that I'm going to be healed. So we have a lot of different things that we have to think about when we speak to a patient because it cannot just be one track, but it is multidisciplinary. There are many different things we have to consider, and we have to also let it be patient-centered.
Thank you very much, Dr. Miller. Dr. Dishon?
Afternoon, everyone. Thanks for inviting us and me. With respect to my bio, there's only a couple of things I want to mention. One, I am first a general practitioner, second, a general surgeon, and then third, a urologist. And I think patients and people always wonder, why are you fixing hernias? And I said, that's because I first was trained to fix hernias long before I was trained to take stones from the bladder or prostates out. I was fixing hernias, cutting off feet, twisting bowel and things like that that the general surgeons do, but I've graduated from that. Now, what do I think is the single biggest barrier to holistic healthcare in St. Vincent? It's hard for me to say because, unlike Dr. Murray, I no longer practice general medicine. I'm a urologist. 80% of my patients are men, and most of them are over 50 years old. And I see a common trend in this country. Men do not take care of themselves. And that's not for not wanting to do it, but because it's not been prioritized. The single biggest reason that men do not take care of themselves is because of societal conditioning. To take care of yourself means you have to love yourself or value yourself. How many of us men from my generation and the generation before have been taught to value yourself? Most men, most of us from my day and older, and even for the younger men I see it too, have been taught to go up, get a job, work to provide for women, children, house, land, car, bills, and even girlfriend apart from wife, or 2 girlfriends, 2 cars, another house. So we actually prioritize things above ourselves. And you know what is interesting? The women are complicit in this. Because women want men who can provide. And they subconsciously encourage men to be ambitious. So men go out, they spend all their lives doing this, and then at age 60, something happens, usually from 50. They come down with a chronic non-communicable disease, like a big prostate in my situation. But most of them who come with prostates come with hypertension, diabetes, high cholesterol, other problems, kidney disease, etc. I see, and I've rarely seen a man in his 50s with one problem. It's usually 1 + 1. The acute one, but the chronic underlying one that was undiagnosed because he's too busy working for everyone else apart from himself. That I find is the biggest impediment to healthcare in men. I haven't seen this in women. Women love doctors' offices. And the reason why men don't go is not because they hate doctors' offices. Let me tell you the psychology of it. He doesn't want to know he has to slow down. He doesn't want to know that he can't provide. He doesn't want to know that he has to depend on others, especially a woman, to provide for him. And hence, he will not go, because going means having to find out something he doesn't want to deal with. Insomuch that when we have men on the surgical ward who has had surgery, women will lie down in bed and they will complain about how much pain they're having, especially on the surgical floor. Nurse, bring a bedpan. Nurse, I can't move. But the men that I operate in within 24, 48 hours, they want to go home. Tie out the sheep, tie out the goat. Many of them can't come to the hospital for the operation. Doc, I have to go to work. They worry more about work than about actually getting the procedure done so he can be better to go back to work. So they push it off, they delay it, and they only come when it's complicated to the point where they cannot work. So the biggest single impediment I see for men, as all men, not just for older men now, even younger men, is that they're too busy working for everyone else apart from themselves. So they cannot take care of themselves. That's like having a truck that you use to do deliveries, and you make money from the truck, but you don't put aside money to take care of the truck when the truck breaks down. So whenever the truck needs a tire, you have to put the truck up, save money for the tire for a week or two to buy the tire to get the truck running again. The same thing with shocks. Whenever it needs shocks, can't run the truck because it needs shocks. And you've known men like that who run in a truck or minibus who have to put it up because it needs a part and there isn't money to buy the part. That's men's problem. We don't love ourselves enough. we do not prioritize ourselves enough. It's societal. It's not just masculine. It's what society expects of us. And that, in my opinion, is men's biggest problem that would prevent us from having a holistic view of healthcare and also taking us from the 20th into the 21st century. Because even with new systems, you're going to get a new hospital, you can get new this and new that, it's not going to change how men view healthcare and how much they take care of themselves.
Thank you very much, Dr. Dishon. You're taking it, Dr. Nichols?
Good afternoon, and thank you for inviting me. I feel very humbled to be part of this panel. There's not much left for me to say, but as an obstetrician gynecologist, my area of expertise is very small. I look after women from the belly button to above the knees. Okay? So I look after a particular area. In terms of a holistic area, I think for women, the biggest thing normally is embarrassment. And not only that, women don't take time for themselves. I hear Dr. Dishon about the men having to look after the women and the children, but I would say about 60% of Vincentians have a single person looking after them, and it's the women. And they have to look after the men. They're not doing a good job. They have to look after the children. And because of that, the children and the men get priority. How many times the woman would have a plate of food and everybody else gets and she doesn't take any because she wants? I think, you see, we have more women in here. They know exactly what I'm talking about. Yes? They're going to make sure that the kids get their food. The husband might get something or the partner, and they go without because they want to make sure that their children get everything. The problem that women have is that because they are prioritizing their children, they put their health on the back burner. Okay? So it's, all right, I have a problem, I'll deal with it later. The other disadvantage that we women have, our organs are not seen. If you have a cut on your hand, you're going to go and look after it because you see it's getting bad. It's getting worse. Your cervix, your uterus, your fallopian tubes, your ovaries are inside. We don't see them. And because we don't see them, we don't remember that they exist. Yes? So we put off the pap smear because we're not thinking about the cervix. If a man has a problem, they will feel it and see it. Or the partner will tell them they have a problem.
And they still ignore it.
So we have to think, so when they come to see me, they may come with something else, but the truth is they're not really understanding exactly what's going on. Yes? Let me give you an example. All women have a vaginal discharge, and that vaginal discharge changes depending on their menstrual cycle. And by the time a woman is 18 years, she knows what is normal for her. Now, the teenager, her body is still changing, so she's not going to know what is normal or not. But 20, 21, 18, she knows what her smell is like, she knows what her discharge is like, and therefore she's going to know what's abnormal. Yes? But because she has to look after the children, and this is August, and she has to buy the school books for the kids, and she has to get the school shoes, and there's this new brand bag now that the children want. What do you call it? That's it. North Face. Yes? They no longer use the Jan Sport. They want so mommy has to take that money to get the North Face. Yes? Or daddy will get it. Yes? All right? So we're not looking after ourselves. We tend to internalize things like our organs. So when you do come to see us, you're a little bit embarrassed. You don't want to think, you don't want to talk about the issues that you have. And you have to delve in and find out exactly what's going on so we can know what's happening. Sometimes patients actually turn up and they say they have an abdominal pain. When you check it out, is some problem with the husband or the partner that they have internalized, and you get a bit of psychosomatic issues. And when you find out what's going on, they're actually worried if the boyfriend or the husband or the partner is being faithful. And then when you start asking the questions, Orhan is agreeing with me. Any smell or discharge, you see the change in the expression. Well, doc, you know, I noticed. Now, they must have known that something is wrong, but they don't want to come to you to discuss it because there's an embarrassment. Because I'm going to delve into your relationship, and you don't want to admit to yourself or to the doctor or to your friends that things ain't going well as they should. So we also still have to have a holistic approach in terms of delving in, asking the questions, and trying to solve the problems. Yes? I'm sure there'll be more questions, but we'll stop there for now.
Tell me you like the way the discussion is going this afternoon. Yeah, good. I have one more question each, a separate question for the panelists. And remember, we'll come to you to get your questions organized. And those persons who are viewing online on the Facebook page, Teachers Credit Union Facebook page, and the YouTube, we'll get your questions shortly. So I have a question back to Dr. Murray. Lifestyle diseases are on the rise. What role do you see nutrition and exercise playing in reversing these trends, and how can patients be motivated to adopt these healthier habits?
Yes, indeed. One will clearly say that there is an increase in lifestyle changes, and that is clearly because people are changing their lifestyles. Kids don't walk to school. They all get, no matter how close they live to their school, they take the bus. They get dropped off, they get picked up. I mean, to be quite frankly speaking, sometimes logistically it makes sense, but by far, kids don't walk to school. Persons are having their breakfast at Subway in Kentucky. So everyone eats lunch at a fast food place. Individuals are, they are making decisions relative to their diet, not necessarily because for nutrition's sake, but in a sense to save money. And of course, and then there's a gym, which persons thinks will, for some reason, will just make them well. The problem we have in these islands, and St. Vincent is one which you see in particular, is that we live in the twilight zone. It's a parallel world. And people don't realize that we're not North Americans. We're not in New York, we're not in Miami, we're not even in Trinidad, we're in St. Vincent. And persons try to adopt different lifestyles. For instance, I'll say to you, I bring my lunch to work every day. Every day I bring lunch. I mean, I do not purchase lunch. And on Mondays, what do I eat? What we cook on Sundays. And if what we cooked the night before, I like, and there's more, that's what I have. I got a refrigerator, I got a microwave. I actually save, and my wife loves to travel. She must have picked that up from a gynecologist. And therefore, I will not buy lunch, and I will save all the money which would have been put forth for lunch for the entire year. And that can pay for an airline flight for 4 to the UK and through Europe, just saving. Most persons who are purchasing breakfast, lunch, and stuff like that, they're spending that money. What I'm trying to show here is that they are eating the same thing I'm eating at home, so why don't they bring that to work with them? Good food, dasheen, tanya, green bananas, good healthy food, but no. Persons are going more towards fast foods. And fast foods sell based on the concept of taste. They're nice tasting. I'm not going to doubt that. They taste nice. And nice taste does not always mean nutrition. And therefore, so what we're seeing is a situation where, and I always say to my daughters, I'll say, look at a photograph from the early 80s, and kids these days laugh and they say, you guys were starving. No. I mean, I was called fat in my preteen, and believe me, I was not fat. The concept is that everyone ate healthy, local, available food and were in good shape. Today, by far, everyone is obese, based on the scale of management. Fast food. I see they have dropped the price on flour. More rice, more flour again. This does not favor, and especially, and doing less. Kids don't do any work. I do farming. Every day I go home, I go to the garden, I plant lettuce, I grow chickens, I do all that stuff. Persons who know me know that I do all of that. I never go to the gym. We have a gymnasium at home. I don't even go in it. And people say, oh, Doc, you exercise and you're in the gym. I say, no, I don't. I do things that keeps me active. I'm from a family that has diabetes and hypertension. My brother died of kidney failure, secondary to diabetes. My mom died of complication of diabetes. I've had 2 brothers who had stroke. And knock on wood, so far, I am diagnosed with hypertension, which I manage. The concept is that lifestyle changes is the number one reason for the chronic diseases which we have. But it's hard to convince persons like that. People think, you know what's going to fix our healthcare system? Another new building. Well, believe me, it's not like that. It comes from, I told a patient like I do all the time, I say, if we want to solve our chronic healthcare problem, it's done in an office like my own. 4 walls, an ECG, a blood pressure machine, a glucometer, and a doctor who will listen to you and speak to you. If that can get through, we will need less new hospitals, less new buildings. What has changed is our lifestyle, and we are trying to live like other persons. We're not living like Vincentians. People go and exercise because they want to fit into a swimsuit, not because they want to live a good, healthy life. And you can do this, believe me, and I think one of the significant action is the food we eat and the exercise you do. And it needs to start from young. I see that at my home. I have my girls, and it's just almost impossible to get them to do anything. And I said to them, guys, you need to get up and do stuff. You need to go exercise. You need to come out. You got to come off the computer. You need to come off the phone. But persons are sedentary, and that, believe me, if 2 things can change, diet and increase in exercise. And I'm not talking about to fit in a swimsuit or because sports time coming up. But general, we will cut significantly most of the problem which actually exists now. And that's at the GP office. I'm going to say it home, I'm going to say it again. We don't need to invest into new buildings. We need to invest into more general practitioners. We need to stop the problems before they become problems. And if every man lived to reach 110, he's going to get prostate cancer. Dr. Dishong knows that. Certain things will come of age. But what we're seeing, if you listen to the death announcement, when the people at NIS say, oh, people are living longer, I say, they don't listen to the death announcement. People are dying young. They're dying from, yes, accidents, they're dying from criminality, but they're dying from chronic diseases at a young age. And what is happening here? Lifestyle. Food, what you eat, and what they are not doing. And to me, that is the real biggest thing. If you climb a breadfruit tree and you fall down and you break your neck and you're dead, that can happen to the healthiest person. But you can have persons in their 20s. I have patients who are in the late 20s with diabetes who have erectile dysfunction. Something you just never thought happened. Hypertension. Persons are coming in with their blood pressure highest, sky high, and try to convince them that you need to treat it. It's very, very difficult, very difficult. Me as myself, I always say to persons, I'm a hypertensive for the past 15 years. I have medication at home and I keep in the office. So if for some reason I run out and I forget, it's in the office. And I love to tell patients that because I let them know that, hey, and I don't want to give away Dr. Nichols' secret here. I don't know if the wife complains, but it works. Because men come with, oh, if I take this, it's not going to work. I say, it's working.
Yeah, thank you very much. Dr. Murray, we'll take another question for Dr. Miller. And as we mentioned, it's a holistic view of the discussion this afternoon. Healthy you, wellness for your mind and the body. So how does mental health influence physical health? And what strategies can individuals use to improve their mental wellness? Dr. Miller. How does mental health influence the physical health? And what strategies can individuals use to improve their mental wellness?
Okay. So when we think mental health, most times persons always believe it speaks of mental illness. So you say mental health and people think about the mental institution, people walking on the street, looking disheveled, looking mad. But mental health is basically speaking about your emotional health and how you think. A lot of how we feel, our emotional health, mental health affects our physical health. How often have you probably gotten up in the morning and say, I'm not feeling 100%, and then literally by not feeling that way, emotionally, then physically you start feeling some manifestations. You're feeling a bit more lethargic, you're not moving, you're not willing to get out of bed, or you start feeling all kind of aches and pains. If you have some sort of distress on your job or at home, relationship issues, and then suddenly you have this headache that is prevailing for a long time, or a lot of the times we carry stress in our shoulders, in our abdomen, in our lower back, and it shows then that there is a mind-body connection. It is important, therefore, for us to be able to be mindful enough to pay attention to the changes in our bodies, because our bodies really do give us information. So when we start feeling this queasiness in our stomach, and yes, it could be a result of acid reflux and other stuff, but it could also be anxiety. When we feel constantly frustrated and we are feeling irritated and we feel this tension in our bodies, we can ask ourselves whether or not we are dealing with overwhelming sadness or depression, what else is going on, if there is some level of grief, because all of this shows in our body. Dr. Nichols mentioned a while ago we have psychosomatic symptoms that sometimes, based on how you are feeling and how you're thinking, your perception of certain things can affect how you physically are going to be impacted. Your perception of pain changes when you're not altogether mentally functional. So you start exaggerating a lot of things. You overgeneralize situations, and everything goes from literally, in our minds, from 0 to 100. And really, it's important then to create a separation between your mental and your physical health. Some of the things we can do to improve our mental wellness, as Dr. Murray says, physical activity, movement. It's important for us to get going again and not be driving anywhere but everywhere but walk. Try to put in your steps. I know a couple times I've seen persons actually doing challenges in their workplaces and other place that you're trying to get to 10,000 steps in one day, and whatever the case is, challenge yourself to keep moving. Physical activity does not always have to be in the gym that you're going lifting 150 pounds and whatever else. No, it can just simply be that you are putting in some movement. And when we engage in regular exercise, we release endorphins, which improves our mood and reduces anxiety and stress. So aim to do at least 30 minutes of moderate exercise. Mindfulness and meditation, where you allow yourself to go quiet. A lot of the times you're always thinking that you have to be speaking, you have to be, sometimes you just need to stop, right? And just quiet ourselves and pay attention to what you're feeling on the inside, what you're thinking, and allow yourself to channel some positive thoughts. We heard a lot about affirmations and being able to channel positive energies and all of these things. It's very important that you be mindful enough of the things that you are thinking about, because our thoughts becomes our words becomes our actions. Healthy nutrition, what are you eating? Your vegetables, very important. Your fruits. Make sure that you are hydrated, that you're using whole grains, your omega-3 fatty acids. All of these things are very important for brain health and function. Adequate sleep. We need to rest. Often persons say, well, yeah, you know, I go to bed at 9, I get up at 6, but are you getting quality sleep? Sometimes we have the quantity in terms of the number, we have the hours, but it's restless because you're sleeping, and most times a lot of persons are now sleeping with their devices next to them that is pinging constantly. Or you might find that persons have a TV playing in the background and all of these different things that can also still create some disturbance to the quality of sleep that you're having. So you wake up the next day and you're still feeling literally as if you have never slept because the quality was not good. So it's important to rest whilst you are sleeping. So we aim for, 7 to 8 hours is what we typically hear, but some persons thrive and do very well even on 5 hours because our circadian rhythm is different and your sleep cycle is different. So some persons might find that if you go over your regular sleep pattern, so if your pattern is 5 hours and you even go half an hour over that, you feel literally as if a big truck has hit you, right? Because you have gone over your natural pattern. Social connections are also good with your mental health, and you have to filter and pay attention to the persons around you. Negative energies. When persons are always criticizing, persons are always fighting, persons are always on a very negative pathway, that is impeding your own natural function. So every single thing, you're at a point where you're even giving up yourself to please others, and that in itself can, impede your mental function. Setting realistic goals, for instance. In life, we are all striving towards something, but we have to make sure that we are setting smart goals, that we are not being unrealistic, that we are not being delusional in the things that we are trying to achieve, but we are working incrementally, and even as you have achieved certain things, celebrate yourself, celebrate whatever successes you may have achieved, and lessen the screen time. Sometimes we need to also spend time with family. A lot of the times I realize when I ask persons, who are your next of kin? I often hear persons say, it was just me alone, I don't have anybody. What does that mean? Sometimes you live in a home and persons are not even talking with each other, you're not communicating. I wish families could go back to the dinner table of actually sitting down and having a meal and talking with each other. Because these days, everybody grab their food and they just run into their little cupboard hole and they're eating their meals by themselves, and you're eating and you're doing this. You're always on the screen and nobody's really creating bonds and connections. And we have to go back to even, pursuing different hobbies, find new things. Engage your mind to do novel things. Don't always just simply exist in this, constant routine, and it becomes mundane and monotonous. You need to infuse new things. So try new stuff, new hobbies, new things like dancing, go on the beach, try yoga, try stretching, whatever. Something that is going to infuse some new energy into your life. And I think once we continually work towards it, we'll be able to have good mental function.
Thank you very much, Dr. Miller. Dr. Dishang, the urologist. What are some common misconceptions about urological health?
One of the most common misconceptions is that I only see men. I've been in this country for 22 and a half years, almost 23, because I'll be January 23. And I still see people telling me, you see women too? Dr. Nickel treats from the belly button to the knees. In women, I treat from the rib cage, just below the rib cage, down to the knees in women and men. I see women with kidney stones, obstructed kidneys, kidney infection, bladder stones, bladder tumors, bladder infection, blood in the urine, women who can't hold their urine, who've been going to see a doctor half a dozen times with a bladder infection to find out that it's a stone or it's a cancer or it's some strange infection that the doctor didn't check for. I see men with the same things. And in addition, I see the gynecological bits for men. The things that Dr. Nicholas said are on the outside. So the penises and the balls. That's why people think that I only see men. In every 10 patients I see, like today, you see 7 men and 3 women, plus or minus a child. So that's the main misconception, that as a urologist, I only see men. Sometimes, in some days, I see more women than men. It's a welcome change. I'm like today, I saw 2 young women like, thank you. Because they're usually in and out fairly quickly. That's why I wish I was a gynecologist. Old men come, they take 15 minutes to get onto the bed, 15 minutes to get off the bed, half an hour to elucidate what's going on. An hour later, they go out of the office and they groan about the office bill. Because men never have money for themselves. If you go at my waiting list, let me give a classic example. In my office is 1 to the most 2. Dr. Nichols is weeks because, as I said, women love doctors. But go to the hospital where it's free. My clinic waiting list runs into January or February because men don't want to pay for their health care. There are more important things, the bills. And trust me, I see men in their 70s still working, and I always ask them poignant question, why are you working? Who are you working for? Doc, it's the grandchildren, and my son living home still with the girlfriend, and the wife ain't well. There is an overwhelming burden of responsibility on men's shoulders. And in the age of women's liberation and equality, I'm still amazed. There's a lot of talk about women being equal and independent and don't need no man and strong. That's talk. In reality, even all the strong, independent women still expect men to provide for them. Sounds bad, but it's true. And I show it. See, the women, they're shaking their head. They say, yeah, although I'm making my own money, his money is still my money. But it's true. They say, my money is mine, but your money is for you and me. And men succumb to that social stigma, or pressure, I should say. And because of which, they do not provide for themselves. So, biggest problem I have as a urologist in this country, that I only see men. That's not true. There's so much female urological diseases that you'll be amazed. And women walk in my office and they say, Doc, even women who come to me, tell me questions. Doc, I didn't know you used to see women. I always think it's men. Yeah, so that's biggest impediment.
Thank you very much, Dr. Deschamps. And question here to Dr. Nichols. What are the key considerations for women when planning for a healthy pregnancy?
All right. I think the ultimate satisfaction for women in general, for most women, is having a baby. Okay? So that is the biggest accomplishment. When I say that, that is in terms of the general scenario. And when you think about it, most women get pregnant without planning, especially teenagers. But before a woman gets pregnant or decides she wants to get pregnant, she should make sure that she is in the best of health. Okay? And 80% of women in the reproductive age are healthy. Now, Dr. Murray just mentioned that he's seen a lot of women in their 20s and 30s with hypertension and diabetes and obesity. And these themselves are risk factors for pregnancy. Okay? So if we have a patient who is diabetic, before she gets pregnant, she really should get what we call pre-pregnancy counseling. Doc, I want to get pregnant, and I want to know if I'm in good health. Okay, so she goes to her doctor, and we're going to make sure and ask questions about her general health, including any medical disorders. Because if she's pregnant, or if she gets pregnant, and she has medical disorders, it can affect her pregnancy. And diabetes is a good one to use as an example. We already know that diabetes has complications. You have kidney disease, you can have problems with your eyes, you can have nephropathy. I've just mentioned that, sorry. Neuropathy, I meant to say, where you have problems with your nervous system. If a woman is diabetic and that sugar levels are not controlled and she gets pregnant, she can end up with congenital anomalies of that baby. So we want to make sure that she has got good, tight glucose control, and we want to do her hemoglobin A1C, which is a test that will tell us if her diabetes is controlled before she gets pregnant. And the importance of that is that organogenesis, which is where the baby is developing, takes place within the first 12 weeks of pregnancy. Now, if I were to ask all the women in this room, those who are still having periods, when was your last period? A lot of you are not going to remember. So by the time the lady realizes that she's pregnant, it's 2-3 months down the road. And by that time, it's too late for us to prevent the congenital anomalies of the baby. And diabetes affects every organ of that fetus. The heart, the lungs, the kidneys, the brain. So we want to know prior to pregnancy that the glucose is controlled. Because when she comes and the hemoglobin A1C is over 6, we know that it's too late. Diabetes also causes miscarriages, stillbirth if it's not controlled, large babies which could end up with complications during delivery. Okay, the same thing applies for hypertension. If she's hypertensive, before she gets pregnant, we want to try and control it. Now, we know that during the first trimester of pregnancy, your blood pressure normally falls. But we also have to think about the medication that the patient is taking. You're trying to get pregnant. Are the medications that you are on teratogenic, meaning that they can cause problems with the baby? Do we need to switch you to medication that is safe in the pregnancy? So let's go back to even diabetes. If you're on glyburide and some of these new drugs, we want to switch you. Metformin is now known to be safe in pregnancy, and that has only come about in the last maybe 15 years. Before, we would switch everybody to insulin. Okay, if you're taking any of these hypertensive drugs, especially the new ones, we want to switch you to something that is safe in pregnancy. The other thing that we want to inform you that you should consider is taking folic acid. We know that folic acid is very beneficial in the first 3 months of pregnancy. And we want to make sure that you start taking it prior to pregnancy because we know it decreases the risk of having spina bifida, which is problems with your spine, and also brain abnormalities. So these are some of the things that we would want to ask. The patient would also be quizzed or asked about past obstetric history. Let us say she's been trying to get pregnant, she gets pregnant and she loses the baby, the pregnancy. We need to know why. Are there medical conditions that she has that may be causing her to miscarry or even not get pregnant? Does she have, there's a condition called antiphospholipid antibodies, where you get pregnant, but because you have a clotting problem, you tend to miscarry. And if these women are positive for antiphospholipid antibodies, we could actually treat them, give them drugs or blood thinners that's going to help with the perfusion of the blood through the placenta and the baby and give them a better chance. Okay? If they've had problems with preeclampsia in previous pregnancies, those are things we have to look out for. So I think that for any woman getting pregnant, you should consider having a session with your doctor, healthcare provider, or even a nurse practitioner, so that they can assess and determine if you're high risk or low risk. I think I'll stop there, and then I'm sure there'll be questions.
Thank you very much, Doctors Murray, Miller, Dishong, and Nichols. At this time, we'll take questions from the in-house audience. A little later on, we have a giveaway. And also at this time, if we have persons online who are following us on YouTube and the Teachers Cooperative Credit Union's Facebook page, we'll accept those questions as well. Sister Nichols will indicate in the back if there are any questions. But for first, let's take questions from the in-house audience at this time. And probably if you prefer to indicate which doctor you like to answer your question or directing a question to. And there's a mic at this side there that you can use.
Hi, good night. My question relates to diet. I know you mentioned about diet, but in proportion, fish to chicken. I know chicken is quite cheap and most people would go that bad, but what proportion you would say is best in terms of diet?
Meals relative to meat, classically, one is looking at where your protein is coming from, and meat is one of our chief areas of proteins, unless if you are an individual who seek to get protein elsewhere from nuts and stuff. But the real issue, quite frankly speaking, is realizing that protein, which constitute the meats like in fish and meats like in chicken, what we're looking for is what we call amino acids, and they're very important because we are actually, what we are doing, we are getting this from other animals and fish, along with other minerals and stuff which we get. The problem comes along here is not always necessarily if it's meat or fish, but rather truly where your meat and fish comes from. And this is what happens. For instance, I got chickens, meat birds, and in 6 weeks, because of genetic modification, not necessarily GMO, but from years of breeding birds to give you ones which can convert proteins very well. Pretty much, a chicken is 6 weeks, can be slaughtered. And it only eats what is fed. And that meal is classically, it's a well-proportioned so that that bird will grow within 6 weeks for slaughter. Now, when compared to fish, most of the fish we get, they grow naturally and wild, and therefore, we are not increasing the rate at which they grow. And they are eaten from literally all over. If your fish is a migratory fish, it's literally all over the world. Or if it's a fish like a pelagian, it's along the coast, and we cannot speed it up. That fish, quite frankly, so long as the surrounding waters are clean, still, and good, that fish has literally, let's call it a better protein, better minerals, everything. So your proportion, to me, if you can afford a better proportion of fish, I will say have less chickens. Because the chicken which people eat, I mean, even the ones which I grow my own chicken, and I can tell you, generally, if, for instance, chicken which was bought in the store was cooked. And I did not see it prepared. No one saw it. And I pick it up and I take one bite. Literally, I just simply say, that's not my bird. And it's true. And that is because I know the taste. And the taste is not just some bird which was pumped up with what I call poor nutrition. And a poor tasting and a poor nutritious meal gives you poor nutrition. You are what you eat. The fish which we get in St. Vincent by far as I know, are nice, natural fish growing in the ocean. Nothing is speeding it up. And because the cost of fish has really gone up, and I've seen that, fish has really gone up in price. Persons literally have to know what they can afford. But fish, to me, will be a better source of protein than chicken. And I dare say, better than the imported stuff. A lot of the chicken which we consume, first, back and necks are great, fine. But these parts of the birds are the lowest quality, full of fat, literally. If you take back and neck and you put it in a pot and then you can just cook it you can cook in its fat, and all you see is a whole lot of oil. I mean, I have dogs, and we use chicken backs and stuff to supplement. And my past 6 dogs all died of what? Cancer. Yeah, they all die. Young. I mean, I'm talking about dogs die within 10 years. And that tells you something. Because chicken is the main protein. Because the dogs just don't like some of the feeds, so we have to supplement, and they die. Now we have switched a bit of that and tried to get the dogs to eat other meals, and they're living longer. I will think that if you're going to eat chicken, grow it yourself, or make sure they're locally grown chickens. If you are going to have chickens which are imported, chicken back and wings and stuff, cut your proportion. I know fish is expensive, but you see, this is what, I mean, let me not say the wrong things here. But I think, part of the wellness situation, it should be to make good food available, not make good food expensive. Because in the long run, it costs us. That's where the new hospital comes in. My point is that let's get fish cheaper. I mean, I say if the fisherman brings in his fish, if the fisherman sells his fish for $6 a pound to the retailers, the state has to find a way to subsidize the fishermen so the fish can be available for the local persons. Because it means they'll be eating healthy proteins. I mean, I know there's a barley fish fresh, I heard. I've never actually been to it. But it's amazing that you just can't get a good fish fry or a good fish anything around in a place like St. Vincent. And I can understand. Cost is a major factor. I mean, I love to go to I'll go to Kaliakoa. I just love to see the fish. I love to go and look at them. And the guys are there, and they're cussing left, right, and center, but, you can't just but I love to see the fish. I love to choose them when they come. And I can remember, I used to pay to them $9 a pound of fish. And I'll take the pictures of them, and I'll send to my wife, and I'll say, hey, I'm getting you some fish and stuff. Fish now, because you pay to get it clean, can easily be $14, $15 a pound. Now, I ain't saying that I am one of the better earning doctors at the table here. But my point is that I know many persons who are not necessarily in the same financial bracket that I am. So why are you trying to? Their children can eat good fish too. And when I think of the cost of fish, I mean, I used to go to Kaliakoa and just buy $400 worth of fish. I just like the look of them, and I'll buy all this fish, and I'll say to my wife, I'm bringing home fish. And in reality, I mean, that will be a splurge for many families. Let's be very realistic. I understand life. But their children and my children are the same children. But can a family in St. Vincent, on average, use fish as a source of protein? No, based on the cost. Whereas fish is a better protein than chicken, and by far better than the nonsense we import and sell as back and neck and stuff, which is what persons can really afford to put meat on. The kids get fat. These birds are, you don't even know where these birds are coming from, quite frankly speaking. You don't even know how long these chicken were dead. I was looking at a documentary where they were saying that on average, the chicken which were in storage and was sold in places were 10 and 15 years because they're frozen and they were just shipping them all over. And with Trinidad had an issue once where a politician raised the issue and he got a lot of backlash because it affected certain persons. He was saying the chicken which they were selling to Trinidad was on average 9 to 10 years. They were in storage and frozen. My point is that what you want to feed your people. Fish to me is a better source of protein than chicken. And I'm not saying don't have chicken. But I'm saying if you're going to eat chicken, try as much as possible to eat local chicken. I sell chicken birds like for Christmas. I grow a little bit and I sell them. And persons, send me messages. Dr. Mary, save me 2, save me 3, save me 4. And I say, well, I just only grow so much. And they're like, I don't want to eat. What do? You put anything special in that? I don't. I treat my birds well. They're well hydrated. I give them good food. I give them good electrolytes. Because what you eat is what is in you. And it is directly related to your general health.
All right. Thank you very much, Doctor. We're looking for more questions from the floor. I see a young lady. Thank you very much.
Good evening. This question is for Dr. Nichols. How would you, as related to your prior question, how would you advise persons with genetical diseases like sickle cell about pregnancy?
Okay, so sickle cell is a hematological disease, and it is genetically passed on. You have to have 2 persons with sickle cell coming together and having a child with sickle cell. If you have a sickle cell trait, which most times you don't have any symptoms, then if your partner has sickle cell trait, there's a problem that you could have a 25% chance of having a child with sickle cell disease. All right? So in my case, if you are pregnant and you come to me and one of the tests that we do is your sickle cell test, and it is showing that you are AS, I will say to you, let's test your partner. If he is AA, which is normal, then we don't have anything to worry about. If he is AS, then I'm going to counsel you that you have this 25% chance of having a child with sickle cell. Now, you can't do anything about it. You're already pregnant. But from a psychological point of view, we can prepare you to that there's a possibility the child could have sickle cell. And I actually usually send you to see the pediatrician so that they could at least let you know. Sickle cell is debilitating, yeah? It affects the chest mainly, that you get chest disease. You also have painful crisis. And it becomes manifest when the child is about 18 months to 2 years. Because the child gets protected by your hemoglobin, because you have fetal hemoglobin and adult hemoglobin. So it's only when the babies start producing their own hemoglobin, or the toddlers, sorry, then you'd realize that they have it. But at least you would be prepared that there is a possibility. There are some patients who, know that they have sickle cell trait, they are thinking of getting pregnant, they would ask the boyfriend, do you have sickle cell? Or do you have a family history of sickle cell? And I've actually had a patient who says, you know what, we're not having any children, because she knows what it's like to have a baby with sickle cell and to watch that child suffer. Yeah? So yes, and this is where the pre-pregnancy counseling would actually come in. So you could actually prepare them so that they will know. Something else that you could think about too is HTLV, which is a virus. And if you have HTLV 1 and 2, we would prepare the patients that it could be passed on to the child through breast milk, and we would actually say to them, we would prefer you not to breastfeed, and because you could pass it on, and HTLV actually cause adult cancers later on. So that's how we would actually prepare and counsel patients. Does that answer it, or you need? Does that answer the question?
Like for younger patients that you see, like of childbearing age, who haven't gotten pregnant yet, and they may want to get married and so on, do you advise them to get tested for the trait along with their partners?
Yes, I've never had a case like that, but yes, we could counsel them, but love prevails. Are you not going to get married because your partner is... Yeah, go ahead. No children. But it's only a 25% chance. So you still have a 75% chance of not having a sickle cell baby. What?
A 25 chance of every pregnancy. Because
every pregnancy is like starting over.
Yeah.
So it's not like having, okay, I have 2 children, one has sickle cell already, so the others will not have sickle cell. It's starting over with each pregnancy.
Because I know of a mother, 4 of her children have sickle cell disease.
Yeah.
So she was unlucky in all those pregnancies.
So she would have a hard time looking after those kids because they're always going to be in hospital with some crisis. Yeah.
Thanks for the question. I have a question from someone following online.
Yes, we have a follow-up question for Dr. Murray. Leah Charles wants to know, what if you can't afford any meat at all? What would you recommend as a substitute?
Certainly don't come steal my chickens, okay? Actually, meat is, there are persons who are actually vegetarians whose meat is not their source of protein. You got nuts. And guess what has a lot of proteins that a lot of people tend to not know? Breadfruit. Breadfruit is actually a high protein. Breadfruit is a high protein fruit, actually. And it's actually earmarked as one of the possibility of a food that can actually curb world hunger. But the tree doesn't take much caring. You guys don't take you the trees in the back of your house. You just grab there and you just pick. You don't even go and prune it. And it bears profusely and bears a lot. Yes. So there are many plant-based proteins which individuals can use. But what actually, in a very practical way, I agree, there's a lot of poverty, I see it. And there are ways to get around these things. And I think that's where the community spirit of things comes in. You see the same way how I grow my chickens? There are ways in communities which families can come together and do things like that. Grow chickens, or if they live close to the sea, you can always hook up, well, when I say hook up with a fisherman, not necessarily hook up, but you can have a relationship where the fisherman will sell you fish not as it's retailed. And sometimes there's some fish which people just don't buy. Like there are some fish which the fisherman will just literally give away. For instance, I like big robin and stuff like that. These kind of fish, so really truly, there are ways of getting proteins from animal source. But yes, you do not necessarily have to get the proteins from animals or fish. There's a breadfruit, and there's another thing I do with breadfruit all the time. We have a tree; it bears a whole lot. And my neighbor and he will climb and he will pick, and sometimes we have like 120, and we will roast them, and we'll share them 50-50, sort of, and then, yes, Dr. Dishon, if you come there, you might likely to get shot. You know where I live? We love to shoot people there. And we roast them, and we'll peel them, and of course we'll refrigerate them. And believe me, you can have breadfruit all during the year, of course, but then it costs you to keep it in the deep freezer, so that's another thing again. But my point is that there are different ways of getting your protein, but one of the key things is to have kids at a very young age as possible to not believe that the meat should be 2/3 of what's on the plate. You have to encourage them to eat a varied diet and not having meat as a center. Sometimes you see people have a pilau and all he's seeing is just meat. You know, one has to start a diet which one can sustain and maintain. Having kids eat the right meal at an early age. I mean, and I'll say this right here because someone's going to look online and say, you hear how he's talking about his 2 daughters? I see them. I have the problem at home with my kids. They're trying to get them to eat correctly. It's not easy. I know what it is. It's not easy to get them to understand that to control their weight and do all of that is to eat properly. The key thing is that you got to be firm and you got to start very early and stop giving them too much money to buy food at school because they'll buy anything they want. Make sure you get packed lunch. Prepare things differently. Maybe you're just not preparing the things in a very interesting way. Find different ways of preparing what you have to make it work. But meat does not have to, and meat does not have to be in every meal of the day. That's another thing. Some persons, if they don't see, we've heard stories where wives get beat up because then the man come home, there's no meat in his plate. I mean, and this kind of stuff. You don't have to have meat in every meal of the day. You don't. Your diet should be varied, and you can get proteins from breadfruit and different stuff, and crayfish, and the protein in the robin is just as good as a protein in the tuna. And all these different things you need to look at. Get the fish you can afford. I personally don't even like those big fish. Give me robin, and I don't like fish head. I mean, and that's just from a kid. When I was a young boy, while I was eating the fish bones, it got stuck in my throat, and I have an aversion for that. I just take off the nice little meaty little bit, and I eat that. But the protein in the robin and the jacks and stuff is just as good as the protein in the expensive fish like Dr. Dichong buys.
All right. Any other question from our in-house audience?
We have a question for Dr. Nichols. What signs or symptoms can women look for that would indicate they are perimenopausal or in menopause?
Okay, so first of all, menopause means that you have gone a whole year without a period. And and the average age for menopause is between 50 and 55 years. But we go through what's called ovarian decline. So after the age of 35, your hormone levels actually start falling. And if you remember, your grandmothers or the older folks used to say, you better go get your child by 35. That's because your hormones start falling. So there is what's called the climacteric or perimenopausal period. So after 35, women start having changes. And the first thing that actually starts happening is that your periods become erratic. Your periods go back to the time when you just started having periods. Some of you would not remember, but at menarche, which is when you have your first period, you used to have long periods, they miss a month, they come for a few days and they come back. That's because you are developing and maturing. After 35, your periods start doing the same thing. So you may miss a period, and then when it comes in for a very long time. So you get erratic periods. You can start having hot flushes. This is a vasomotor type of reaction where you get hot and then you get cool. Your mood swings, so you start to get irritable, and your children and your partner start making little comments about how you're cranky. Dr. Miller, why are you looking at me like that? Yeah? Your skin change, you start to get dry skin, it starts to get cracked, your hair starts breaking, you get dry. This is a big thing for women and for men. You get vaginal dryness. Because your estrogen levels are falling, your vaginal tissue, your bladder tissue, your urethra, which is the small channel that takes the urine from the bladder to the outside, is estrogen dependent. So if your hormone levels, your estrogen levels are falling, you're going to get changes. So you find that you have irritation, you find that you think you have a urinary tract infection and you want to go and see Dr. Deschamps. He can't deal with that. All right? Because your hormone levels, your estrogen levels are dropping. You get dry down below, so sex becomes uncomfortable. And you might have to use some KY jelly or some moisturizer, vaginal moisturizers. There is also the problem with relationships becoming problematic because your partner cannot understand that you may not have the same sex drive that you had when you were 20. Sex is uncomfortable, you're dry, you don't feel like it, and therefore you don't want to have sex because of the pain. And there are treatments that we could offer you to help to beef up or juice up the vagina. Okay? Insomnia is another one that you have problems with. You find you can't sleep as well. You have depression. Those are some of the other things that you can have. And in terms of long term, when your estrogen levels fall and you start going through menopause, you increase your risk of osteoporosis, which is where you get brittle bones, and your cardiovascular or heart conditions or diseases increase because estrogen protects them. Yes? So going through the change of life, which is what it is basically, from the climacteric period to menopause, your body changes. And I think we as women have to empower ourselves as to what to expect. And we would expect or hope that your partner will be understanding, basically, of the changes that you're going through. This is not the time for him to go and find a young girl. All right? Because our Dr. Deschamps, behave yourself, please. All right? This is when he should be understanding and be supportive of you as you go through this. When you start going through menopause, you put on a bit of weight also, so your self-esteem becomes problematic. And it takes a little bit of encouragement to understand, for him to understand and be supportive of you. Does that answer the question?
Question? Any other question? Thanks for that answer.
Dr. Nichols was saying that's the time for men to be understanding, and that's true. But men react to menopause the same way. Older men react to menopause the same way younger men react to pregnancy. They might understand, but to be crude, them still want sex. So they can still go outside. It sounds bad, but it's men. And this is my problem I have with men in our society. They don't want to be truthful. And you women know it. They will say one thing in public, but in private they will do what you know all the men do. And the problem I have with women is that you're complicit in this silence, this toxic silence. You know a man cheating, but you hope it isn't so. And you know he's done it because somebody tell you, you see him, he brought home another child, the relationship break up because you're pregnant or because you're going through menopause. But we all hope that it's not going to happen. It's like marriage. 60% of marriages break up, but everybody still encourages you to go get married without realizing why is it breaking up and how can we fix it. You see what I mean? So, yes, it is true. But at the end of the day, you go through menopause or you go through pregnancy, the man might be understanding, but at the end of the day, men will be men. They still want what they want. They will support you, and they will help you, and they will be there for you. It's painful, but it's true.
Thank you very much, Dr. Dishang. Another question from the audience.
Yes, this question really is actually for Dr. Giselle Miller. It is? Yes. So, of recent, we've been having issues where mentally unstable persons may have hurt somebody. There was an incident in the Leeward side where a child actually was killed. So my question relates to, when is it in a family circle, what are the triggers you would say when a family should really reach out to engage or get help if they notice that there's a family member who is potentially unstable?
Okay, so we want to look at change in functionality, so things that the person would usually do. So when you start seeing that they have probably issues in terms of basic things, hygiene, not taking showers, not grooming themselves, you see that they're becoming very irritable, very hostile. Little things become an area of frustration. If they're not sleeping, and this usually is one of the triggers that you see that for days they might just have moments where they're taking little naps, but they're not consistently sleeping and resting. They might be up a lot, just pacing the house, or speaking to themselves, very loud. You might see changes in the mood, very erratic behavior. So sometimes they start laughing, crying. Their emotional state seems to be all over the place. You want to pay attention to if they start abusing substances, so if they're taking any sort of drugs. The alcohol, the marijuana, a lot of persons now seemingly are mixing the marijuana with other drugs, whether cocaine or other things. You want to pay attention as well to if perchance they are speaking as if they're speaking to someone who isn't there. So you want to rule out if there's any hallucinations, whether auditory, so they're hearing voices, or they're seeing things. Once you start seeing any of these, it's important to get that person to the practitioner, to the doctor, to see what is really happening. Sometimes it could be a case that they are not taking their medication, or they're not taking their medication accurately. So some persons are taking it, but they're not taking it in the right way. You may find, though, that you want to get them help before it gets to the point where they are very aggressive. Because at that point, you more than likely would have family members saying that I'll have to probably call the police because you can't convince them. So you want to make sure when you see the smaller changes, convince them to get the help there as well, before any other thing happens. Now, I know a lot of persons generally are afraid of persons they deem to be mentally ill. But we often say that even the research has shown it, that mentally ill persons are not typically violent people, unless, of course, they are not taking their medication at that particular time. But persons who are medicated, they can be just as functional as anyone else. Persons diagnosed with mental illness, possibly because of the stigma and discrimination, you'll realize that they tend to isolate themselves. They prefer not to be around people as opposed to be around persons and be uncomfortable. Just like any one of us, if you are attacked, you go into defense mode. And most times when you see some persons acting up aggressively, sometimes it could be because they felt threatened in some way as well. Okay, and we have to somewhat normalize the whole idea that just as we have a diabetic, a hypertensive, a cancer patient, HIV, all of these different illnesses, that they are still functional enough once they are medicated and they are seeing their doctors. Same with mental illness. If somebody has schizophrenia and they're taking their medication, they're following the treatment regimen, they can have normal functioning lives. It's just that, you have to be mindful of what triggers them, and they themselves have to be mindful of their own triggers.
Okay. Any other questions? I'm looking at the time, and I'll probably take 2 more questions. If anyone else from the audience, if anyone else online, Sister Nichols?
We had someone who had a question for Dr. Murray in regards to the discussion we were having on alternative proteins. They were saying, isn't breadfruit high in carbohydrates? So what would eating plenty of breadfruit do to the diet?
Breadfruit is actually, yes, it does have this staple, but when it comes to carbohydrates, we must be very wary that we have a nice simplification of what we call simple and complex. Now, to make it quite frankly, breadfruit falls under what we call in local parlance hard food. And that when you, for instance, if a person were to eat, let's say, half a pound of rice, and another person ate half a pound of breadfruit, the person who ate the rice, who goes to the toilet, will pass little stool and kind of like, it's not rope-like, but the person who ate breadfruit, they're going to produce a more ropey stool, because there's more roughage. There is more constituent in the breadfruit, which we, us mammals, cannot process. So it's a very safe, it's better for persons to actually use hard food, breadfruit, as opposed to having rice and flour. Because rice and flour, most all of that is converted and then is trapped in the body as storage or usage. So even though when we look at the carbohydrate content of the breadfruit, it's actually better, because then it will not be a situation where all of that is actually being absorbed into your body. And that's just by looking at the stool content. It gives us a good idea. A fair amount is going out. And roughage is good because it cleans the gut. It ensures that persons get a regular stool. You'd be surprised the amount of person who have constipation. And when you check on the diet, they're using cereals in the morning, rice, bread. And if only they will consume like breadfruit right in the backyard. And there's so many ways you can actually use the breadfruit. So even for diabetics, sometimes persons wrongfully think that, well, breadfruit has carbohydrates, so it is not the ideal thing to, not necessarily. It's actually much better, because even the release of it, that is, when you consume food and it goes through the digestive system, if it's a simple carbohydrate like rice or flour, it's quickly absorbed into the bloodstream and the sugar goes very high. If it's a complex carbohydrate, as we find in dasheen and breadfruit and such, it takes a while for the body to process it. So the release of the sugar and it being absorbed into the bloodstream is over a longer period of time. So it's like a rocket. You know that rocket those guys sent to the space recently? If everybody looked at it, how they at certain times, certain portions of the rocket is being fired, which propels it forward. If it just all just lit at the same time, it'll blow up. The same stuff is that when we take breadfruit and such stuff, it allows you to release that energy slowly, which the body can use and process. And believe me, another good thing about that, because the processing takes longer, you don't feel hungry. And that is one of the things with simple sugars. When you eat that cornflakes or whatever thing in the morning, you're already by 10 o'clock you're hungry, because there's nothing in the stomach. It's all absorbed, it's all gone everywhere. But if you eat hard food, it gets into the stomach and it takes a good 3-4 hours in there processing, and you don't feel that hungry and you don't have that desire to go eat again. So really, truly, it is, yes, based on the calorific content, breadfruit will have, yes, a lot of starch and energy, but how these things are measured scientifically is what they do. They take a portion of the food and they put it into a chamber and they burn it and they see how much energy comes out of it. Well, we don't have that system in our body. A fair amount of the complex carbohydrates never gets absorbed by us. And therefore, you will not have an issue of having a lot of high amount of sugar for storage. So breadfruit still champs rice and flour.
Thank you very much, Dr. Murray. And that's puts a wrap on the working session, we may call it, and this health symposium here, annual health symposium put on by the Teachers Cooperative Credit Union under the theme this year, Healthy You, Wellness for Your Mind and Body. I know there's an official vote of thanks a little later on, so I wouldn't go into that. At this time, we have a giveaway, and I'll do that, and then we'll call the marketing manager of the credit union, Mrs. Melissa York Nichols, to do the vote of thanks. And I understand that there are gifts for the panelists. I don't know if anyone for the moderator, but the giveaway. Yes, yeah. The first person, and this would be the in-house persons there, because we wouldn't be able to check online. 1 ticket to Lions Club Wine and Cheese soiree to the person who answers this question correctly, and by showing of hands, you can shout out. If you can name the newest branch of the Teachers Cooperative Credit Union. You can answer, Ms. Peters. Ms. Peters, you are on one of the committees. I would even ask if you are if you are disqualified. Yeah, I know that the newest branch, Teachers Cooperative Credit Union, opened a branch. I think it was in January this year. Where was that? Where was that opened? I think it's Miss Metchesint said Chateaubriand first. Barley was around for a long time. So Miss Metchesint, I don't know the name. So you go right ahead and get your 1 ticket to the Lions Club Wine and Cheese soiree. Thank you very much. What's the name? Rachel. And at this time, we'll ask the CEO of the Teachers Cooperative Credit Union to help with the handing over of little gifts to the panelists. Ms. Jasmine Daly. At this time, we'll call Dr. Murray to accept his token or gift. I wish you had bought some chicken. Put your hands together for Dr. Murray. And I must say the time flew by very quickly. I had a good time. It was a great discussion. Dr. Joselle Miller, psychologist. Put the hands together for Dr. Miller. Dr. Dishong, put the hands together. Urologist. And remember, ladies, you can see Dr. Dishong. 20% of his patients are female. I learned something. 30, see? And Dr. Nichols, gynecologist. Thank you very much. And we'll welcome to the podium now, for the official vote of thanks, Marketing Manager of the St. Vincent and the Grenadines Teachers Cooperative Credit Union, Mrs. Melissa York Nichols.
Thank you, Johnny P. On behalf of the management, staff, and board of directors of the SVG Teachers Cooperative Credit Union, we would like to extend a heartfelt thank you to our panelists this afternoon for agreeing to be a part of our 4th Annual Health Symposium, to Dr. Giselle Miller, Dr. Camille Nichols, Dr. Rohan Dishong, and Dr. Wayne Murray. Thank you so much for being here with us and answering our questions and sharing your knowledge with us. We truly appreciate you assisting us to providing that information to our members. We say thank you to our ever ready and able Master of Ceremonies, our moderator here today, Brother Johnny P. Straker. Thank you for always saying yes when I call you. I truly appreciate it. Thank you to you, our audience, who are here with us today, and those of you viewing online. We truly appreciate your attendance. To Paul Gans and his ITFX staff for assisting with the streaming of today's event. To Mr. Dillon of NLS Sound for assisting us with our audio today, and our ever able and trustworthy photographer, Mr. Seymour Hines. Thank you so much for being a part of the Teachers Cooperative Credit Union's Health Symposium. Thank you and have a wonderful evening.
This will come to a close, and get home safely. Thanks so much.
When disaster strikes, don't let it keep you down. At TCCU, we are here to help you recover and rebuild. Whether you need to repair your home, replace essential appliances, restore your business, or secure your property, our disaster loan special has got you covered. Act now, recover, and rebuild. Thrive with TCCU. Visit any of our branches today or schedule your appointment online at www.tccusvg.com. Together, we can weather any storm. SVG TCCU Limited. Terms and conditions apply. Ready to hit the road in your dream car? With our exclusive vehicle loan special, you can. At SVG TCCU Limited, we offer unbeatable rates, flexible terms, and fast approvals. Whether it's a sleek or sporty car or a rugged SUV, we've got you covered. Don't wait, accelerate. Fuel your future with SVG TCCU's vehicle loan special. Visit any of our branches today or schedule your appointment online at www.tccusvg.com. Drive your dreams with SVG TCCU Limited. Terms and conditions apply.